so kind, staring out into space, asking God to hear my case, trying to think of all things past. How long will my memory last? The purple angel, purple angel, purple angel, you're next to me.
Well, hi, everyone, and welcome to Alzheimer's Speaks Radio. I'm Lori LeBay, the host and founder of Alzheimer's Speaks. Today, we're going to have a great show, and we're going to be talking about telemedicine, which is just kind of cutting edge these days. But before we get to our guest, I always like to explain to our new audience, because we're always getting new listeners, a little bit about Alzheimer's Speaks, who the heck we are and what we do. And bottom line, Alzheimer's Speaks was created because my mom had dementia for 30 years, and I just didn't feel like we were raising everyone's voice, and I didn't feel like our family had enough access to services, products, and tools. And so Alzheimer's Speaks is not just a radio show, but we have a blog, we have a resource directory. I do educational programming and consulting and training, etc. So bottom line, what we are is an advocacy-based company providing multiple platforms to shift our dementia care from crisis to comfort around the world. We believe that by joining forces and sharing knowledge and having these everyday conversations about life with dementia, that we're going to be able to remove the stigmas attached to memory loss, and we're going to let families live fully with and right alongside this disease. At our core, we also believe collaboration is the only way that we're going to win this battle against dementia, because at this point, there is no cure. And so, we have to kind of hold hands and walk together and listen to one another in terms of what is working. And this truly is kind of a trial and error, if it's research or if it's social support that we are giving to find out what is working and what can we try, and also to ignite our creative abilities, because we each hold those in a little different way. And so it's very exciting. And I have to thank our audience. Because of you, we were named the #1 influencer online for Alzheimer's, according to ShareCare and Dr. Oz. And we were also recognized as an architect of change by Maria Shriver for humanity. And let me tell you, that would not have happened without you guys, because we don't have a marketing budget. Everything we do here is word of mouth. And so those recognitions really extend to you being on our team and part of our team. So I just want to thank you. I also want to let you know that, maybe you could be our next guest, because, again, we like to hear from everybody. So maybe you're a person wondering if you have memory loss. Maybe you are a person who has been recently diagnosed, or a family member or a loved one caring for somebody who has a story that they want to share. Maybe you're a business that's developed services, products, or tools. Maybe you've written a book, a song, a movie, or you have created some kind of advocacy project, or you're working on a research endeavor. Give us a holler, because, again, the only way that we can move forward is to listen to everyone's voices and I think truly work as a team. So the easiest way to catch me is just go to alzheimersspeaks.com. Both are plural. That's alzheimersspeaks.com. And up top, you'll see a big contact button where you can go ahead and shoot me an email, or feel free to give me a call as well. And I would be glad to have a conversation with you. This fall, for those of you who aren't aware, we are going to be doing a cruise. We are going to the Bahamas for 7 days, and we are going to have a symposium. We're going to do a lot of relaxing, a lot of rejuvenating, and a lot of learning and building camaraderie. And it's going to be a really unique cruise, because my team of speakers for the symposium has 2 other professionals like myself. Cindy Lazinski, who also is working with dementia-friendly communities in Colorado. And we also have Becky Watson, who is a music therapist. And then the highlight is we have 4 people living with dementia who will be speaking as well. Harry Urban, Michael Ellenbogen, Lori Shearer, and Mary Reed. And this cruise is designed specifically for people with early to mid memory loss and their care partners. Now, some are bringing full families, others are just bringing one care partner. Whatever works for you, we would love to have you join us. And again, just go to alzheimersspeaks.com and you will find lots of information there. You'll also find where you can download some helpful hints when dealing with dementia. So feel free to go ahead and do that as well. Well, I don't want to waste any more time. I really want to get into this conversation of telemedicine and dementia. And I'm honored that we have Roger Santos with us, who is a subject matter expert in the field of telemedicine. And he has spent about the past 30 years in collaboration in terms of different types of communicating technology in not only the corporate world, but higher education and the healthcare sectors. To really work kind of remote interactive communications. So the past 12 years, Roger has really worked specifically in the telemedicine system and the applications for hospitals, clinics, in rural communities. And, you know, rural communities so often get left out. I think this is just a wonderful sector. And so today we're going to be talking about this area of concentration of his work and how telemedicine and interactive technology applications work for memory care specific and just gerontology in general. So welcome, Roger. How are you today?
I'm very good. Thank you very much for having me on your show.
Well, I'm excited to have this conversation because I think, you know, our healthcare is out of whack, costs are through the roof, and we need systems that are going to work and that are going to drive costs down and care up. And so, first of all, before we start, I always like to ask all of our guests one simple question, and that is, has you or your family been touched by dementia at all?
Yes. So my mother has mid-stage Alzheimer's, and it was initially her diagnosis that got me thinking more about how we deal with and manage the care for Alzheimer's dementia, and then a number of other categories when the majority of that person's time is spent away from a medical facility and clinic. Mm-hmm. What happens in that interim period that is important for your practitioner to know about, and what can we do to effectively help mitigate and slow down some of these congenital diseases and things. So she was my model for getting into this.
Yep, it's amazing when it touches your family how everything changes.
It really does.
You know, the old saying goes, you don't know what you don't know, and I don't think that's ever been truer, you know, in this particular sector. I mean, it's kind of phenomenal what we don't know. Why don't we talk a little bit about telemedicine and remote patient monitoring? And first of all, what are they? Are they the same? Are they different? Is it just two different terms? Or what are they? Just why don't you share that with our audience first to give us some basics?
Sure. So telemedicine is typically a term that is applied to instant or real-time communication between a patient and a provider, care provider. Mm-hmm. And in that, you can have strictly voice, you can have voice and video, voice, video, and data. That data being real-time monitoring of vital signs or updates of captured information. Mm-hmm. And that captured information is the monitoring part of the equation. So when you're not actually engaged in a consultation, you are living your life as normal. So having devices that allow you to be monitored in the case of Alzheimer's dementia cases, you might have, say, bed monitors that notify and record excessive movements, maybe a lot of thrashing around at night if you're restless. It might record you getting out of bed and send out an alert that tells your care provider, the person who's perhaps with you, that you are doing something that could potentially hurt you if you are a potential high-risk fall category person. Motion monitors throughout the house, monitoring your daily motion and activities for continuity. And when the parameters of the monitoring solution are exceeded, either too little or too much of any given task, a note, depending on the severity of the discretion between the norms, is then sent to a provider, notifying them that something out of the norm for this patient is occurring. And then that doctor, that provider can make a judgment call as to whether to contact and get direct information about what's going on with that particular patient, as opposed to waiting around and gathering the data that is collected over a predetermined amount of time, uploaded, and then they do an assessment analysis. Mm-hmm. So there can be a quick intervention component to monitoring a patient from home. That patient can also enter in pertinent information. Maybe it's a diary log, maybe it's data about their diabetes numbers, maybe their weight, blood pressure, heart monitor, any number of things captured, recorded, and then an analysis of that information can be used to ID whether conditions that patient's going through who happens to have Alzheimer's is consistent with other patients, and are there other components to Alzheimer's besides memory loss that we should be aware of that are directly affected by the disease itself. Mm-hmm. And when we go to treat these other seemingly isolated things, should we be thinking of them in terms of being cause and effect? So that kind of data is incredibly important, and that's called monitored data. And it's remote monitor, updates you at particular intervals. And then again, back to the video conferencing or the telemedicine component, you are sharing in real time what's going on.
Okay. So, when this monitoring is taking place, is this, just for clarification, does this go to, let's say if I was taking care of my mom, would the information go to me? Does it go to a doctor? Does it go to a third-party service? Where exactly does it go?
Really good question. So there are a lot of companies out there who are working on providing RPMs, which is remote patient management tools, application that sits on a cloud and you can access it through a tablet or some interface device. Presumably it's designed around being very intuitive for the end user to use, and the information is put in. The passive information gathered by motion detectors, bed monitors, etc., can be captured in a way and then reviewed by the patient, by the care provider, by your doctor. So anyone authorized to look at and see what's going on can do that. So if you have, your children are far away, you have an in-home care provider, all of the information and things that are gathered and put into the system can be pulled up remotely on a mobile device by your children, anybody you give authorization to, so they can see in real time where and what is going on with you. And these are wonderful tools to help keep you fully connected and aware of everything going on, because we can't always be geographically in the same space. Companies like Care Innovations, for example, have put together solutions that are end-to-end. And what I mean by end-to-end is they work with the provider, they work with the payers, whether they're private or public payers, insurance companies. And when there's an authorization from either of them for a patient to have a system, the company sends out a box with all of the appropriate pieces prescribed by the authorization person. And when it arrives, they're contacted by, in this case, Care Innovations, and they are given a walkthrough tutorial on how to use the system. And it's a very intuitive solution. But they are a 24-hour, 7-day-a-week call that you can make at any time as a patient for support. So this takes a company who is providing a service on behalf of a doctor and or payer that makes the information available to not only them, but everybody that is appropriate to have access to the information. And it's tools and processes like that, along with back-end analysis. So algorithms that are developed to take in the information that's coming to them, analyze that information, and make some determinations. As we get in further into the world of artificial intelligence, the algorithms are making much better analyses and choices and informing in real time better information for the providers to react and respond to a lot of the conditions that we see in our patients. Mm-hmm. And I use that particular company just as an example of where you might start looking to understand what the tools and solutions that are out there, and there are many, and then how to go about looking into getting and being part of that type of program.
Okay. Well, and I appreciate you kind of defining payers too, because a lot of times people don't understand the verbiage that's used out there in the industry. With this, so let's say a family decides they want to get involved with this. Do they set this stuff up themselves, or do companies come in and do this setup? Because I know, I've heard there's all different kinds of things, from lights that can go on just as, to light up the way as people go to the restroom, and it's checking to see where they've been, maybe in their house, if they've gone to the restroom, if they've gone to the fridge, if they've opened up the cabinet that has their medicine. There's so many different things that it can do. How does that work? Is one, and then two, does the system you're talking about use video cameras in the home? Because I know that there's some real pros and cons that people feel really strongly on both sides with having cameras on in the house as far as privacy goes.
Absolutely. Okay, so to answer the first part of that question, the way in which companies engage and support vary depending on the provider. So let's build a mental picture of what's happening. A manufacturer develops a particular application and some hardware tools that allow you to interface with that application. The scope and depth of what that application will do as far as gathering the information, how it gets the information, and that vary company to company because there are so many different levels of needs and requirements for patients. So what the procedural process of this is, provider, your doctor, or payer, your insurance provider, has said, I want my patient to have some service, and they define what that service is. And they have manufacturers that they work with who develop these things and will ship this stuff out. Mm-hmm. Okay. So a request goes to the manufacturer puts together the appropriate box of stuff, sends it to the patient, it arrives. This is where the variable comes in, depending on the company that's providing this. So I'm very familiar with Care Innovations, so I'll use their model as an example. So the product arrives, the company calls that person, it confirms the arrival time because they've been tracking the delivery as well. They confirm the product has arrived. They walk them through opening it up and answer any and all questions that patient has, just to get them up and running and started. And they walk through everything, mm-hmm. and then remain available to be called at any time if the patient has additional questions regarding the equipment.
Mm-hmm.
Most of the equipment that you receive is fairly straightforward and easy to use. We're usually fairly comfortable with it. When it gets a little more complex, where you're doing passive monitoring, where you may be installing motion detectors, you're setting up and maybe having to connect bed monitoring devices, things of that nature, companies like theirs will contract with install providers that will come out locally if they don't have their own, come out and they subcontract them to come out and fit all that up for you,
Mm-hmm.
get it up and running, walk through, test the whole system, make sure everything's working correctly. And that's essentially the process. Most of the time, the monitoring tools and solutions consist of things like a tablet where you can enter in information, a scale with a Bluetooth, maybe a blood cuff that does blood pressure monitoring that has Bluetooth, and these things just automatically sync up to the tablet that comes in your kit. Most always you'll receive some sort of a tablet interface with a custom interface that is very big in icons, very easy to identify, and with a very simple flow process, so that the information gets put in and captured and then put into the database in the cloud, where the patient's doctor and everybody else that is assigned can access and see the information. But it's usually a very simple process. But if you do get into physical implementation of devices, installation type setups, those services are already prearranged for helping you get that put together.
Okay. So I have a question, because I was talking with somebody the other day, and I honestly can't remember who it was. And they're like, oh, yeah, this will take your blood pressure and it'll do this and that. And you just wear this system and it does all these different things for people. And I thought, man, if that was just me without dementia or somebody with dementia, that would just scare me if something just started blowing up my arm. You know, that would scare me. So,
well, it does. And having, you were there, and I've just very recently experienced this with my mother. We were in the hospital, and the reason we were in there is another good little story that is in support of doing telemedicine remote monitoring. But anyway, they would put on the blood cuff and start pumping it up, and it would cut into her, or it was squeezing her arm too tight, or something, and she was irritated by it.
Mm-hmm.
And this is something we've all grown up with. We've done for many, many, many years. But when we're in this particular condition, it's not the same thing. And then, of course, doing this at home really it takes a partner, someone there who's working with you as the patient to really help you through the process.
Mm-hmm.
And the further through the process you go, the more difficult using any of this equipment is. But it's still very, very vital. And if I could just share an anecdotal story
sure, please,
around what makes that vital. So recently, in the case of my mother, we had in a little bit of excitement where she was already prone to fall, but she was feeling very dizzy. And she had no outward signs of any problems other than being very dizzy. And then fell, collapsed, and needed help getting to the hospital. We did that. And they took an MRI.
Mm-hmm.
The physical therapist evaluated her, could find no physical outward signs of any issues or problems. But after the MRI, they realized that there was an arrhythmia from the heart that had caused some aneurysms in the brain, small, little, tiny ones. And that comes back to is there a cause and effect? Everybody can have these without having dementia, but is there a correlation between the two becomes a question. Mm-hmm. And coming back to the whole home monitoring, whether you're in an assisted living or you're at home, wherever you are, monitoring and being able to start putting these patterns of conditions together, and then being able to look at that data and compare it to another person's data, compared to another person, and we start to build a model of conditions that seem to be, that correlate around the dementia condition. gives us a quantum leap forward in understanding of, one, what to anticipate, but two, what sort of things may be causing or creating additional conditions or issues around the initial component of Alzheimer's, and whether or not treating any of those subsets or seeming subsets will affect or help the condition of the Alzheimer's. This kind of data and information is absolutely critical to getting us to a point where we can actually say, we're ready to start attacking and defeating the condition of Alzheimer's. The more we get, the more data we get, the more we understand about this and its process and all of the subset things that go into it, the better off we are as a community in trying to resolve and defeat this.
Mm-hmm.
And so that's another example of why it's important to have good monitoring, consistent monitoring, whether you're at the hospital or at home, so that data doesn't get lost. Oftentimes you walk in, the doctor says, so how do you feel? And at that very moment, you feel great.
Mm-hmm.
But for the last 3 weeks, you've had a number of things that you've completely forgotten about that would be relevant or important to share. Well, now that's captured. And the doctor can look at that data and then review it with you and say, okay, well, what about? Oh, yeah, that's true. That happened. But that's why. And I apologize. I think I missed your second question a minute ago.
Oh, that's okay. I forgot what it was by now anyway. So
okay.
we're good. We're good.
We're on the right show. Okay.
Yeah, you're on the right show. I just think it's so important in terms of getting some of these things established early. And I think so often what happens is people say, well, we don't need that yet. But, as my experience anyways with my mom was, if we would have implemented these things earlier on, then it wouldn't have caused her distress. It would have become part of her routine and kind of a natural process for her.
Exactly.
And, if we can avoid like trips to the doctor, because after a while, that was a horrible process for her. She always, every time we went to the doctor, she thought, oh, something's wrong, something's seriously wrong. Where she used to like to go to her doctor, and she was very much doing all of her annual, exams and things, but it just got to the point where taking her out was just traumatizing to her. And if there would have been a way to filter that information, when she was in the nursing home, then she ended up having a doctor and nurse come to her, and she didn't have to go out, but still having that information translated and charted and just accessible, because it's hard for families to make all the notations that we probably should, and it's difficult for a person with dementia to remember to do it as well. Life is busy, and a lot of times we think little things aren't important, but when a professional looks at them, they see things in a whole different light. And,
Absolutely.
And so I think that this is very, really interesting concepts. As far as, because people are going to want to know about costs, is this stuff covered by insurance, or is this all out of pocket? And why don't we just start with that? So I won't forget my second question I gave you. No.
So, back to our friends, the payers. We often think of ourselves as being the payers, but in fact, in this case, we're really talking about the insurance companies and private versus public. There has been a tremendous amount of change in coverage and what's acceptable coverage. And it might even surprise you who the early adopters in covering this sort of care really were. Mm-hmm. It turns out the private payer was actually among the first to accept this over the public paying. So Medicare, Medi-Cal, very slow to pick up on this. But the reason, when you start to break it down, becomes fairly intuitive just from a financial side, because more and more we're trying to prevent the readmittance of a patient to a hospital for the same problem. It's an extremely expensive proposition to bring them to what we refer to as the brick and mortar world. And it is terribly inconvenient and uncomfortable for the patient.
Mm-hmm.
You've seen and personally experienced, I'm sure, all of the long wait times in the lobby. Then they finally call your name and they put you into a small little room where you get to wait even longer for about 5 minutes of your doctor's time, whether that's in an emergency room or whether it's at your private physician. It's not a process that is conducive to your individual health. And when you're dealing with dementia, now you're really compounding the problem, because moment by moment, there's a fear and an uncertainty and anxiety in the patient that says, why am I here? What are we doing? Who are these people? I am not comfortable here. It's noisy. Their anxiety level goes way up, which skews a lot of the information that would otherwise be very important for the doctor to have. By moving them to that home care environment, the insurance companies realize that they gain advantage on cost and on actual usable data information that potentially can prevent a larger issue, problem, complication going forward.
Mm-hmm.
So there's a real financial motivation on the behalf of insurance companies to participate. Now, that said, it hasn't been a rocket ride to the top of the acceptable paying. And the reason for that is political, not financial. And each of the states, even in fact, I think it was early at the beginning of this year, the last state, Texas, signed legislation that said you can actually take on a provider that you have not actually personally seen face-to-face. Through telemedicine, you can establish a relationship with a provider and have care treatment. These are huge hurdles that we had to overcome in the acceptance of telemedicine as a legitimate interface or an encounter for a medical condition of any kind.
Mm-hmm.
Having made that hurdle opened up a lot of doorways, but a few of the ones that are still closed evolve around where you are as a provider, as a doctor, providing treatment for a patient for a particular condition. In the context of what we're talking about, typically our loved ones have got access to a doctor locally who is following their condition. And they're not traveling around the world or out of state. But specialists and that want to or can play a significant role in their care have to be licensed in multiple states in order to participate and be part of the payment process.
Mm-hmm.
It's a very convoluted logistical thing that we're really unwinding. In the early years of telemedicine, it was just simply looked upon as a really cool toy that nobody wanted to pay for and no one trusted, and how could you possibly gather relevant information if you couldn't meet and see and touch the person.
Mm-hmm.
That's being eclipsed by a much broader acceptance and understanding that we have a decline in specialists and providers taking care of us, and we have a growing population. And the population, I'm sure you've shared with your audience, and they're well aware of the 65 plus category of folks in the U.S. alone is going to reach somewhere in the neighborhood of 80 million by 2050.
Mm-hmm.
So a quarter of our population is going to consist of folks who are going to be in the category who would truly benefit from telemedicine. So insurance providers are jumping more and more on board, realizing the cost benefits savings to them, and the politicians and organizational structures that are in place to regulate medicine and that are capitulating and saying, yes, this is the new paradigm. Yes, we have to start going here, and start treating the encounters as though they are brick and mortar face-to-face encounters,
Mm-hmm.
and paying equivalent to that of an encounter in an office. So the paying component is important too. Medicare, Medicaid, as we all know, typically does not pay as well as private payers, but so the battle between the private payer and the public payer continues on. Even with telemedicine, it doesn't really change that paradigm. But as you're following legislation and everybody's idea of what's the best solution, which still hasn't really been presented by anyone yet, but we're working towards it.
Mm-hmm.
Hopefully that component evolves to be much more respectful and responsive to these needs. And I think once you're diagnosed and you're in this particular category, it becomes much easier to get authorization for payment for services like telemedicine and telemonitoring. These devices do get paid for through those processes, but you got to work with your provider or your payer to get that done.
So I guess I'll just bring up a concern I would have as a consumer in terms of paying the same amount, because staff time is going to be reduced because I'm not interacting with, a receptionist and a nurse and a doctor, and those things are going to be different. And I look at just in terms of telecommunications in general usually cut costs. And so if the costs that are being cut are really at the consumer end in terms of the drive time, and, maybe they don't need Metro Mobility to get them there in a stress level, but it's really not cutting medical costs down from the insurance side. So as a consumer, that would just be a thought that I would have in terms of adjusting that somewhat, because depending on what they find, you might have to go back in and things could definitely change. I was in, and I'll use real estate for an example. Real estate started doing a lot more stuff electronically, and now they don't need as many buildings. They don't need as much office space. I mean, because business is being done differently. And so, I just think that needs to be looked at in the equation as well, because otherwise it's not, as much as it may help the consumer, it's still not helping our budget issues that we have at hand. And so I'll just throw that in because I'm sure that I've got listeners out there kind of thinking that same route, with this. I also think that, if there's reduced costs with that, there may be more interaction, for somebody. So at a lesser acuity level, which is better for everybody to be able to catch things and monitor things. And I also like with the whole concept of the telemedicine, and we saw this a lot with social media groups dealing with people with dementia. People say, well, those people aren't, you really don't have relationships with them. You don't have friendships. You don't have this. You don't have that. And yet those contacts were much richer and deeper than what they were having with people face to face, because so many people were isolated. And so I think there could be a burden taken off there, and maybe even different levels of players coming in to analyze things to try to help keep costs down, where maybe it's not a doctor, maybe it's an LPN that's, or a triage kind of person who's handling the call initially to kind of see where it needs to go. Or maybe it's a home health care organization monitoring it before it gets to an actual physician level. I don't know what and I think all of them probably have different levels of criteria on how they work with all of this stuff. Am I correct in that last statement? What do you think of my comment as far as costs?
So I agree. The overall start with the cost part, and that is that we pay a deductible typically with our insurance policies. That would probably be modified somewhat, because in a encounter typical today, we go into an office, well, they're paying rent, they're paying for utilities, they're paying for staff and some other things that go away to a degree. you still have a billing agency back there. You now have an IT infrastructure organization. You do have the cost and time of the provider, the doctor themselves, but some of the ancillary costs that are typically built into our billing do tend to go away through this automation, which is a great thing. Then so our deductibles may go down. The cost of the actual encounter for the payer goes down. And subsequently, we're looking at a better financial cost for care through telemedicine than we did in a traditional encounter role. And as far as the infrastructure goes, the procedural. So if you're being monitored, typically that's going to be done by a technician who's going to be assessing and evaluating the data that comes in. This isn't necessarily going to be your doctor or even, say, a PA or a nurse practitioner. It's a technician who's going to be trained to evaluate and assess the information and data that's coming in. If it's something that, again, falls out of the norm or needs escalation, then there's an immediate escalation path all the way through to an actual care provider or doctor or specialist, whatever the appropriate response level is. So the idea that we have somehow eliminated some of the levels of infrastructure within the medical practice hierarchies hasn't actually gone away at all. We've just simply geographically dispersed them. So I might have a technician reviewing this. It's kicked up to a nurse practitioner. The nurse practitioner calls and says, what are your meds? How have you been taking them? Do you need a refill? That sort of thing. And there'd be a direct encounter there. If there needs to be an escalation beyond their level of care, then they bump it up to the doctor. And then when we have a predetermined date of encounter face-to-face through video with a doctor, then we get that encounter. So everybody is still all involved in this process. Labs get their information, doctors get their information, etc. And the nice thing about the systems today, how they've evolved, is that you can be on any device. You can be on a tablet that is provided by a home care monitoring solution company, or you can be utilizing your own tablet or your own smartphone or your PC. Anything with a camera and a microphone will do. And so it makes getting the care that you would get where you are possible anywhere anymore. So you don't have to worry about, well, we planned a getaway vacation. You're taking a whole bunch of folks on a cruise. Each of those people could have daily contact with their provider as if they had never left home. And everything about them would be known, and the care would be there, etc. So your medical support goes with you wherever you go.
Okay, as long as there's internet access, all is good.
There you go. Okay. You could be on a safari in the middle of Africa and still be okay.
Okay. Well, I have so many other questions for you. There's a lot of kind of virtual reality that's going on and roles that it plays with mental health and also dementia. Let's talk a little bit about that too, because that's very interesting to me.
Very exciting stuff, yes. So virtual, your audience has heard virtual reality. They may have heard augmented reality. And even fewer probably heard of mixed reality, which is a combination of virtual and augmented realities. So let's break it down a little bit. So virtual reality is think of it as a gaming environment. Basically, you create a virtual world environment anywhere in any construction. It could be imaginary moon station where you live, or it could be living in the middle of France or the outbacks of Australia. It could be anywhere.
Mm-hmm.
And you create the environment and the scene, and you interact with that environment by moving around, looking at different things, and information can pop up. And by wearing goggles, you are able to be immersed. And by turning your head left to right, you get multiple degrees of view of the environment in which you're in. So it's what we refer to as an immersive reality encounter.
Mm-hmm.
Now, on the virtual reality side, why is that relevant to what we're talking about? There isn't a lot of data yet on the total benefits, but the anecdotal information available today on the benefits of virtual reality and these encounters for patients with Alzheimer's, dementia in general, is tremendous. It stimulates the mind and gives them an encounter that they're lacking. They're surrounded by four walls and the same faces every day. They become just a bit lethargic and apathetic to the environment, and they tend to close off. Well, this re-stimulates the mind. It is as real as their mind allows it to become,
Mm-hmm.
and it becomes more and more so. What they've found is that patients who are withdrawn, non-communicative, have a half-hour session, hour-long session, just in virtual reality. They are engaging, they are excited, they want to tell you about it, they want to share the experience, and there's no limit to where you can be or what environments you can explore when you do this. You can be on that cruise virtually,
Mm-hmm.
you can be anywhere, and it gives them a sense of away and different and stimulates us.
Mm-hmm.
And it's, again, yet to be fully determined the complete benefits and value to it. But anecdotally, everyone who has participated in it from a patient standpoint and a provider standpoint have just praised it considerably. And I can't advocate it enough.
Wonderful.
Augmented reality is slightly different.
Mm-hmm.
So augmented reality allows you to put objects into virtual space. And that sounds very high tech, but it just means that you wear a visor with a clear glass screen, which has an image projected on it of anything you can think of. It can be objects, specific objects like lamps or desks or PCs or whatever you can imagine. Simple blocks and shapes and colors. And what you do is you physically move your arms in air in front of you, and looking through the lenses of these headsets, you see what it is you're grabbing or manipulating and moving. And you're tracked. And the way it works is there are cameras in the headset that monitor where your hands are in virtual space, correlate that to the object that is being projected, and it appears in your mind's eye that you are grabbing a thing, moving it to another location, and you get a response to that thing. So in simplest imagery, we would say if you had a stroke or you had Alzheimer's and you had hand-eye-arm coordination restrictions, and you wanted to exercise them. Physically, you're now moving your arms and grabbing and doing the things that are good from a motor skill standpoint. But by using the augmented reality, you can grab an object of a particular shape to put it into the corresponding shape's hole, pulling it through using your hands and building objects in virtual space, which gives you cognitive strengthening and mental dexterity to see what needs to be done, put things into proper sequences, plan and retain information long enough to make a choice or decision around what it is you're doing.
Mm-hmm.
So programs designed specifically to work with the acuity of the patient, depending on the condition, whether it's Alzheimer's or it's some stroke, or if it's even something, childhood disease for autism, maybe. Anything you can think of which would be beneficial to be stimulating the mind and action and response. So you get a reward for the action that you've completed and done. That engagement, utilizing augmented reality, is an exceedingly important thing. One of the companies that I like there that are doing really wonderful things, and it's such a new venue. But Meta has just a fabulous headset product and tool, even in the early stages of development, where this is something that is applicable for general use medical applications and many other applications, of course, but just speaking to our audience, has really only been around about 5 to 6 years in practical terms. So there's a great deal more for us to do and develop and grow. But by introducing this to our patients, you're re-stimulating a lot of things that are going dormant while we go through the process of Alzheimer's. And that's, to me, that is just phenomenally important.
Okay. Well, interesting. There's lots going on, that's for sure.
There really is. It's a really exciting time to be engaged in a lot of this.
Well, we only have about 7 minutes left here. What else would you like to discuss? Because I know I want to make sure that we get out there what you feel is important, because you're the expert in this area.
Well, so what I would say is that it's really important that we start asking for these tools. They're out there. What we don't really have today is a good marketing of what's available. What do we have that we can be asking for? Providers hesitate because there is a cost association for their initial engagements. They've got to look at whether they can recoup. A lot of them are still touching their toes in the water of telemedicine. There are large medical networks that are fully engaged, but there's still some levels of disconnect. And if we as patient and patient care providers are stronger in our advocacy for getting access to these tools, then we're going to see this much more mainstream. We'll start recognizing and seeing this in news cycles. We'll see it in advertising. We'll see it out there. And that's really, really critical to making the kinds of inroads and the information and data that we can collect from these virtual world encounters, right down to motion and response, that is an invaluable tool to get us to the point where we can start looking at ways to start curing these things. These are all ways we can contribute towards the ultimate goal, which is being able to eradicate it. It's understanding it. And to understand it, you've got to really see all of the things going on with the person. So these tools are things we need to advocate for, ask for, start talking to your payers, start talking to your providers, and demand that you have access to these things and getting them paid for. This is how we can move the whole thing forward.
Okay. Well, that sounds really interesting. I'll have to send you some information with a company that I'm working with that is pulling together a huge resource directory specific for dementia. And I think these types of things would be ideal to be listed on there, because not only will the medical models have access to them, but so will the public. And maybe we can get that conversation started more, because I really think that is how dementia has made as many changes as it has just in the last 5 years, is just getting the conversation going. And, it takes a little while to kind of drill deep enough to get that conversation going. And we still have a long ways to go. But, you're never going to get there if you don't start. So I will send you that information as well. Anything else that you'd like our listeners to know?
Well, I'm going to be a little presumptuous and speak on behalf of your listeners and myself in thanking you for putting the work you've put into making this a lot more visible, allowing a voice for this platform, and helping all of us get out what needs to be gotten out there. Thank you very much. You've been tremendous for all of us.
Well, thank you. It's just something I felt as a family member that was needed, and somebody's got to start this stuff. So I just look at it.
Absolutely.
Why can't I be involved? And that's just always been my attitude. And I like to try to get other people to feel that same way, that passion. That we all have purpose, we all have passion, we all have different ideas, and there's absolutely no reason why we can't implement them. We just have to start.
Absolutely.
And we have to have faith that, our views are unique compared to others. And, but yet when we start having the conversation, you realize how in sync they are with so many. And you just start aligning with those who believe like you, and things can happen fairly quickly. And not cost a lot of money, not take a lot of time. And all of a sudden you've got this network of passion that just can really push over some barriers and make some changes. So I appreciate, all the work that you have put in to telemedicine, and also the remote patient monitoring, and then sharing with us the virtual reality and the augmented reality as well. It was just a really interesting conversation, and I hope people will check out the links that we have there for you too on our blog, and look at some of the videos as well. And please feel free to reach out to Roger. And what contact information is best for you, Roger?
So I can easily be reached through LinkedIn. I've got a profile page there where you can submit any questions, contact, and get in touch with. You can also direct email me at roger.santos@ngcc5.com. That's the number 5. Either method, and I will be happy to contact and get in touch with you and share everything that I've got and help move this forward.
Okay, great. Thank you again so much for your time and your work in this movement. Really appreciate it, Roger. Before I wrap up, again, I just want to give a shout out to people to please come and join us on our Dementia Friendly Cruise and Symposium, November 11th through the 18th. We're going to be going to the Caribbean with Holland America, and it's going to be a lot of fun. And I think you'll learn a lot and walk away with a lot of new friends as well. You can find information out by just going to alzheimersspeaks.com, and then you can always contact Kathy Schoaf, who is our travel agent for our group. As far as Alive and Social in our past shows, they're all archived. We've been doing this for 6 years now, so there is lots of information out there. The most recent shows we did had to do with living and dying, and it was just a really, really interesting conversation that we had with the authors. We also had former Governor Marty Schreiber on, who wrote a book about his 2 Elaines, because his wife has dementia, and he talks about learning and coping and surviving the journey itself. As far as dementia chats goes, the last one that I have posted has to do with social media and the impact it has on those living with dementia. And I'm in the process of editing one, so look for this one on laughter and humor with people with dementia. I think that'll be very, very interesting. On the blog, a couple of things of interest that you might like is there is a beautiful poem submitted by one of our members called A Rose in the Snow. And there's an article on Arthur's Residential Care, who is kind of one of my favorite places. I think that they just do an incredible job caring for those with dementia, and some contact information for you with those. And we're going to be having an upcoming article by dementia behavior specialist Elon Caspi, and he has written a paper for the journal, International Journal of Social Research and Practice, called "Trust at Stake: Is the Dual Mission of the U.S. Alzheimer's Association Out of Balance?" In the meantime, have a wonderful week, and we will talk with you all soon. Thanks so much, everybody. Have a great week.
Hey everybody, Jared Sebestier, host of Retire Repurposed. This podcast is dedicated to help people transition into fulfilling and purposeful retirements. Retirement is a big life change. In fact, the two most dangerous years of a person's life are the year they were born and the year they retire. Few people can just flip the switch from working a career 30 or 40 plus years, retiring on Friday, without methodical steps to living what we call a repurposed retirement. To listen now, search Retire Repurposed on your favorite podcast platform, Senior Resource, or Life Audio.